So coming around to the side, see how he's swinging his butt? I'm trying to be his wall here. But when we get him to reach, he starts tilting his head off to the side. We should be able to see him come right back. He's like kind of getting frustrated with me because he should be able to tilt his head all the way back to the flank. You know, usually they can itch right around their, point of the hip. But he's having trouble coming around, so that's why the head tilts off to the side like that, as opposed to coming straight around. And that means usually there's restriction in the opposite side in the cervical vertebrae. Some more gas. Let's see how far. Oh, on this side you're tilting a little earlier, but you're coming back a lot farther, so that's good. Use the point of the hip, and same thing to make sure there's movement in the pelvis. And yeah, we can see that's bouncing really good. So you come off the last rib and up to find like the first lumbar vertebra, and then if you just hook your fingers over the edge of the tail and isolate that vertebra with your thumb and just kind of pull, you can see he's kind of got the wiggly motion, even his head is jiggling. That means that's good. That vertebra is free. And you can just move down and check each one individually, and you want to see that nice serpentine movement all the way down the spine, head and everything moving. So this side of his lumbar is really good. He's very free. Oh yeah, he's kind of shrinking there actually. We can already tell there's restriction here because it's even hard to get in to isolate that vertebra. Like you said, he did like do a little shrinky away there, but this longissimus muscle here, you can see he's already tensing all up. It's hard even to get into that vertebra and isolate it because the muscle is guarding. The vertebra is still free because we can see the serpentine movement all the way down the spine, so that's good. That means soft tissue as opposed to chiropractic. Awesome. Okay, so right in here, as soon as we're pressing here, we can see pain in both of these muscles. Both of them react right away. They start restricting because there's pain there.
I think he thinks she's got the spot.
Oh, good. Getting that full extension with the leg back there on retraction.
Yeah, if he could talk, he'd be going, oh, that's the spot, that's the spot. Look at that face.
So you can check to see, again, imbalance at the pole to see the first vertebra, the first cervical vertebra. If you stick your fingers right in behind the jawbone and right between, you can feel the little bump of the wing of the atlas. And right there, below the ear, you should feel how many finger spaces you can fit between there. And it should be even on both sides.
Okay.
So if you can only fit 2 in on one side and 1 in on the other, then you know you've got a cervical imbalance. Fortunately for him, I don't think that's the case, but I just thought that was an interesting little tidbit. Maybe C4 we might have an issue here because it does feel a little bit farther out on this side compared to the other side. Oh, buddy. Just want to try to bring his nose around towards me. There we go. Good boy. That's a chew, that's good. So now let's check and see. Let's see, big guy. Well, I don't seem to feel a big bulge on this side anymore, so hopefully it adjusted that easy. So he's coming way farther than the first shot that we got.
Yeah, he's still tilting his head,
Yeah,
though.
he's still tilting his head. Which again, that makes me think that there would be something higher cervical too. Hey, big guy. Can you come up and over this way? Oh. Can you come up? So I betcha. That's a little better, but yeah, he's still really having trouble coming up. Normally they can come up and tilt their head way off to one side and the other, and he's really reluctant to bring his head up and kind of